Hi, my name is Tsun. I'm a psychiatrist from New York and co-founder of Affect Mental Health. I'd like you to meet Montez. She's a proud mother of 2 and grandmother of 5. She works at the food bank and lives in her own apartment where she loves to play Jenga with her grandkids. And her guilty pleasure is Taco Bell. If you met Montez, you would not know that she's in recovery from schizophrenia and cocaine addiction, and that she's been the subject of over 100 911 calls, and that she's been hospitalized for over 200 days in a locked psychiatric unit, and that because of her untreated mental illness, she was previously homeless and jailed several times for violent behavior. Unfortunately, what Montez had to go through is common for people in our communities with severe mental illness. My patients, like Montez, would go missing. And when I found out that they were inappropriately trapped in jails and prisons, I felt a deep injustice. Like many of us today, I turned my anger into action. I now work to break this terrible cycle of people alternating between homelessness, hospitals, and jails. We all know someone with a journey similar to Montez, whether it's a client you provide services for, or maybe a family member. A root cause of this cycling is that the healthcare, housing, and criminal justice systems are siloed. At Affect Mental Health, we are solving the multiple system failures, much like we discussed today, that trap people in this vicious cycle. We're building a world where severe mental illness is not a diagnosis of doom, as Kara so eloquently shared yesterday, but a world where people can thrive and flourish, just like Montez is doing now. We take a 2-pronged approach. At the client level, we provide coaching to service providers on evidence-based practices. And at the systems level, we facilitate contract negotiations to integrate the health, housing, and justice systems to prevent people from getting into the criminal justice system. Here's why both coaching and contracting are important. We know that best practices work, but implementation is challenging. So we provide high-touch coaching on evidence-based practices supported by data-driven population health management. Innovative contracts between service providers and payers, such as local health plans, local governments, enable financially sustainable collaboration across the health, housing, and criminal justice systems. Everything we do is designed to improve outcomes and generate cost savings so that the infrastructure we build in each community is self-sustaining. Now let me tell you about a few of the best practices we enhance with our coaching. Assertive community treatment, or ACT, is a life-changing care model for people with severe mental illness and the highest needs. ACT involves a psychiatrist, peers with lived experience, therapists and addiction counselors, housing and vocational specialists who all help clients stay out of the hospital and achieve housing stability and employment. And all of these specialists deliver their services in the community where clients are. My mentors at University of Rochester developed an adaptation of ACT that decriminalizes mental illness called Forensic ACT. By working with drug and mental health court judges, probation and parole officers, Forensic ACT cuts recidivism by half and reduces hospital days 5-fold. And this training has been delivered in over 65 counties across 7 states. The majority of ACT clients are homeless. So we bring together ACT teams with Housing First, which is also a national best practice. The guiding principle is, as soon as you say yes to housing, your life changes. Housing First is designed to meet clients where they are, whether or not they want treatment or are still using substances. And with continued engagement from ACT teams, 85% of clients remain stably housed after a full year. So by supercharging the hundreds of ACT teams across the country with Forensic ACT training and connecting our clients to Housing First, we enable people with severe mental illness to thrive. Now you may be thinking, these comprehensive services sound really expensive. Well, in the US, we are already spending $38 billion in healthcare for people with severe mental illness. A lot of this spending is from avoidable emergency room visits and hospitalizations. So when our coaching prevents these expensive hospital visits, we're able to reinvest these dollars into housing and data-driven collaboration to keep people out of the criminal justice system. We know that when Forensic ACT and Housing First are delivered with high fidelity through coaching, they improve outcomes and reduce costs. Each ACT team serves about 100 clients and can save $1 million in healthcare costs every year. To reinvest these savings from avoided hospital visits, reduced bookings, and days in jails or prison, we use shared savings and value-based contracts, social impact bonds, and performance-based contracts. These contracts amplify existing funding sources. ACT is already Medicaid reimbursed in over 40 states, and Congress has deemed Housing First as the solution to homelessness, opening the door to local and federal dollars for supportive housing. To secure this sustainable financing, we've partnered with Corporation for Supportive Housing. They have a tried and true approach, securing over $1 billion for supportive housing models, including ACT and Housing First for justice-involved individuals across the country. With performance-based contracts in place, we need to deliver better outcomes and reduce costs from expensive hospitalizations and criminal justice system utilization. So this is why coaching is so important. And we all get better at what we do when we have coaching. It's the coaching that generates the improved outcomes and shared savings that drives financial sustainability. And we all learn just as much from our colleagues as we do from our coaches. So we have virtual learning communities across multiple states to share lessons learned. And finally, to improve outcomes and reduce costs, we facilitate data-driven population health, integrating data across the 3 silos of healthcare, housing, and criminal justice. For example, we take statewide data from the Health Information Exchange and integrate it with the Homeless Management Information System and real-time jail stay and booking data. And it's our coaching that makes all of this data actionable at point of care. Our team of coaches and contracting experts is the glue that brings together the health, housing, and criminal justice systems. What makes our approach unique is a relentless, data-driven focus on financial sustainability. Together, I look forward to co-creating a future where people like Montez with severe mental illness who are inappropriately criminalized can thrive and flourish. We're currently active in these states and looking for more partners. So if you're interested, please email me, and I look forward to collaborating. Thank you.